You are watching the Doctalk show.
There are several types of pains that you might experience in your lifetime. You have the physical pain, which results from an actual injury to your body. You can have the psychological pain, which is a distress to your mental well-being. Spiritual pain as well, relating to your mental well-being. So with me, are a team of experts who deal in addressing physical pain. And the good thing about it is they do not require medications. Yes, you don't have to take all those numerous medications such as the painkillers, the morphines, or the Panadols that most people are accustomed to. We are discussing pain control without the need of medication. So to further understand, I want them to explain how exactly how exactly they relieve pain in their particular fields, which kind of people are supposed to see, for example, a physiotherapist versus vis-a-vis sports therapist, vis-a-vis chiropractor. So we'll start perhaps with you, Dr. Kayondo. A physiotherapist, I know it's a very, very common field and many people are familiar with it. We commonly see, doctors commonly prescribe that as a way to increase muscle function, like in situations of stroke. But how exactly does physiotherapy address pain control?
Okay, thank you very much. Physiotherapy, as you said, is a broad medical profession, but like I'll focus only on issues of muscles because we're talking about muscle pain. So like in cases like you said, stroke, if the limb is not moving, if you've got a stroke, your body parts are not moving. That means you're not using your muscles. So there is potential for muscles to shorten, and like when they shorten, the joints get stiff. So the moment you try, it's like you're starting from scratch. You're trying to this is a glue and then you're trying to unglue it. So they're going to have pain. So physiotherapy helps you in your ailment or like in your stroke, keep you moving, keep the muscles moving. Because our bodies are not meant to be in a static posture. They're supposed to be moving straight.
So every patient who has the unfortunate experience of experiencing a stroke must see a physiotherapist?
Yeah, that's very true.
Okay.
Low back pain, which Dr. Sawana also addresses, but me, I may look at how you see the posture corrections because it involves posture as well, like inactivity, like getting you back to activity, like inactivity causes a lot. When you sit, you're inactive, so it may be leading to your pain. So I may help you be active even in your office, like how you can stretch and like get up and stretch and do things like that. So like in osteoarthritis, some other cases like osteoarthritis, like we pretend not to, like when you're having pain, we withdraw. So you don't want to use the joint because there is pain, but you're accumulating more pain in the joint.
Okay,
So
maybe just to understand osteoarthritis.
Okay.
What
The osteoarthritis is bone disease, like wear and tear. It might be caused by infection or wear and tear. So your bones, your joints are not moving as they were, or like they're rubbing on each other. So there is inflammation in the joint. So if there is inflammation, you would not want to use them because there is pain. Whenever you move, there is pain. But things like hydrotherapy, like if you do it in a pool, there is buoyancy, helps you to move your joints with less pain. So my aim is like movement. I focus on movement, how you move.
Amazing. So how you move and how you sit might cause that chronic pain you're suffering from. So it might be good to visit the office of a physiotherapist to advise you on what to do with that pain. But I'm curious now, Mr. Sinna, you're a sports therapist, so for a moment it almost seems like physiotherapy resembles sports therapy. What is the difference between the two?
Not a difference.
Yes.
So it's kind of attached onto all of the subjects. So the chiropractor. So my service is sports therapy and also use exercise in terms of that. So the difference is, again, as a professionals, we always do consultation. We do assessments. So partly you do part of the assessments, we do static assessments, we do dynamic assessments, which I'm sure someone each house they do. Okay, so then once we establish the assessment, the treatment is kind of similar, but at the same time different. So as I demonstrated earlier, that I use manual therapy, which is basically working on the muscles. So I can work on the muscles either using sports massage to break down the tissues and in order to align the tissues.
Okay.
Then after the tissues are soft and aligned, I use mobility work, manipulation of the joints, promote the range of motion. Then once that's finished, then I pass into Dr. Sawana to align your spine alignment. Then once that's finished, again I pass into Solomon to do some physio work.
Okay.
Then when the two finishes, then they come back to me, I start doing exercise. So we do the rebuild.
Okay. So it's kind of an interconnected thing.
Yes.
So you might be specialized in a particular field of sports injury, but you need the service of the chiropractic or the services of the physiotherapist to help the patient to improve.
Yeah, so in order to get a complete alignment and also to be pain-free, you need more than one specialist. You can have one specialist, but that will be only temporary. But if you're looking to move the pain completely and give a patient understanding, this is where it comes in. So you have to look at other people to come in.
Okay, so Dr. Sabwana, your field is relatively new, I think, in people's understanding and experience. They have never really heard of something called chiropractic. So I know you've explained it's to do with diseases of the nerves, the bones, and the skeleton. So how exactly does it address pains, for example, pains of the nerves?
Chiropractic mainly emphasizes the mechanical component of it. The body is a locomotor system. So, and the environment in which the body operates is not ideal. So the body is vulnerable. In easy way to move to exploit the environment is vulnerable to mechanical disorders, what we call biomechanical disorders, and the problems related to mechanical causes. Okay. So that's where we come in. As I said, chiropractor, we tend to see patients directly from a community. We can be referred to, no problem, and collaborating with other practitioners, but the difference between a chiropractor and a physiotherapist, and maybe even a sports specialist, like what Mr. Sina does, is we tend to receive patients from the community, whereby we have the role and duty of evaluating the patient, come up with a diagnosis and plan of management.
How about versus orthopedic? How do they relate?
Orthopedic tend to deal, they also deal with the musculoskeletal disorders, but mainly for our differences, for us we deal with mechanical problems. And orthopedic people, or orthopedic practitioners, tend to deal with the traumas, broken bones, and other diseases, inflammatory processes, or even cancers affecting the bone. They work hand in hand with
the surgeons.
Physicians and their surgeons, as you put it.
Okay, so the chiropractors do not do surgery.
We don't do surgery, and we don't prescribe medication. But we offer all forms of other treatment approaches to address mechanical disorders of the body, especially the spine and pelvis.
What are the examples of the mechanical problems the spine can easily get?
Yeah, those are the various strains which the spine can face. As we say that the body, the environment in which we operate is not ideal. There are many things which affect the body as we live, we move in the environment. Like as my colleagues have said, the kind of roads we use, the posture faults, sitting at work, all of those also contribute to mechanical situations which affect the body, particularly the spine. Because the spine is the frame of the body on which other body parts are built in terms of musculoskeletal system. Okay. So when we assess the spine and see those mechanical disorders, then we make our plan of management. And our treatment approach normally involves, one of my colleagues has said the manual techniques. But in chiropractic, we use the term adjustment, or some people call it manipulation. So we determine areas of the spine or and other musculoskeletal system which is affected by those mechanical disorders and contributing to the pain and other symptoms. Then we come up with our techniques which have evolved over years of chiropractic existence. The number of them there is no time to go over them. So we use those manipulative techniques to address those mechanical disorders of the musculoskeletal system, basically to alleviate pain, as we said, but also to address other symptoms like improved ranges of motion, and also there is what we call a proprioceptive input to the joints. When we do those maneuvers, we add proprioceptive input to the nerve ends,
Kind of improving the
which
sensitivity in
also
the joints.
fire somewhere. There is a theory we call it pain gateway theory. That is a very important
I think we shall
theory
come
which we
more
use.
to that theory because we have to go for a short break. But yes, I think we can understand the diversity in the treatment options that are available to controlling chronic pain. So after the break, we shall tell you exactly where you should go if you are experiencing a certain type of pain. Who should you start with? And how can you know it is time to see either a physiotherapist or an orthopedic or a sports therapist or a chiropractor? So don't go away. We'll be right back after the break.
You are watching the Doctalk Show.